I'm Jason Wasfy. I'm one of the assistant medical directors of the Mass General Physicians Organization. I'm really happy to be here with Jeff Ecker, who's the chief of OBGYN and co-chair of the Opioid Task Force. We've just been talking a little bit about opioids. Jeff, I guess the first thing I wanted to ask about is that, when I was a house officer, we didn't even really have the term substance use disorder. There really has been a lot of progress and innovation in this space, and maybe you could just talk a little bit about your approach.
So first, I think there's no denying the problem, Jason, and I don't think anyone would argue that it's a key issue today. I'm told that 5 to 6 people die in opioid-related deaths a day in Massachusetts. That's 5 times the number that die in car crashes.
Wow.
And Massachusetts, compared to other states, is among the worst in that regard. So Clearly something we need to do things about. Not all of that is about inappropriate prescribing, prescription narcotics. And arguably 80 to 90% of it is related to undertreatment of a chronic disorder, substance use disorder or addiction.
Interesting.
In thinking about approaches to it, there may be 2 things to emphasize. One is, though I've said it's not all about inappropriate prescription, appropriate prescription is important. And as we in OBGYN, but I know throughout the institution, have thought about it, people have identified wide variation in the number of narcotics and type of narcotics prescribed for similar patients and similar procedures.
Interesting.
So departments, I think, are increasingly interested in looking at that variation. In OB, we looked at cesarean sections and found wide variations. We're able to standardize that. In so doing, decrease the number of pills prescribed, and studied it at the same time to demonstrate that satisfaction was okay and pain scores were good. So that's one thing one can do. But obviously there's a lot of effort needed to be focused on those with substance use disorders. And within the hospital, there are a couple of key initiatives that are happening there. One is that the addiction consult team is available Monday through Friday in hospital, quickly paged to the partners paging directory. They're also available nights and weekends for emergencies. The Bridge Clinic, upstairs here on the 8th floor in the Founders Building, available for walk-in, great for transitions, whether it's from the ED or outpatient or at the time of discharge. We're looking, addiction consult team and others are looking at using recovery coaches, hiring more recovery coaches to assist patients with this problem. And finally, ours and a number of practices are embedding folks within the practices to work on this, increasing the number of Suboxone providers, for example. So the problem is daunting, but there are a number of things that individual providers and practices can do to make a difference here.
Yeah, I mean, I think it's really remarkable, just as a clinician, it's really remarkable that you've been able to demonstrate reductions in unnecessary opioid prescriptions while maintaining the satisfaction with pain. Because, we just don't want people to be, we certainly wouldn't want people to be suffering unnecessarily, but at the same time, we don't want to overprescribe and have some, induce some problem in the patient or their family. So it's really remarkable that you've been able to do that while maintaining excellent pain scores.
Yeah, it's not just us. I mean, it's happening elsewhere. And the last thing I'd add in that regard is one thing I think that's important is to get the pills out of medicine cabinets. So you've prescribed an opioid. At the next visit, ask whether or not it's being used. And if not, offer information about how folks can dispose of it. Recently, there's a new medication disposal bin over in Yawkey to supplement the one in the White Lobby. So great options there, but there are other options for safely disposing of narcotics. And that's something that, again, in our practice, we hand out. Every time we hand out a prescription, there's a quick card that we give patients so they can anticipate how to get rid of it when they're done.
That's remarkable. I just think it's such wonderful work that you've done. I mean, there's such unusual opportunities to both improve quality and value in healthcare for our patients. And that's, I think it's really wonderful that you all have done that.
Glad to do it.
Thanks so much.
You're very welcome.